Compassion, competence, and autonomy are not exclusive to dentistry. Yeah, we can. One second. Sorry, I have a message from our coordinator, our beloved Salome. Okay, all good. It's okay. Salome, welcome. So next slide. So compassion, defined as an understanding and concern for another person's distress, is essential for the practice of dentistry. In order to deal with patients' problems, the dentist must identify the symptoms that the patient is experiencing and their underlying causes, and must want to help patient to deal with these problems and to relieve, for example, pain. Patients, they respond better to treatment if they perceive that the dentist appreciate their concerns and is treating them rather than just their illness. A very high degree of competence is both expected and required for dentists. A lack of competence can have serious consequences for the patient. Dentists undergo a long training period to ensure competence. It's undergraduate studies, yeah, you understand, and postgraduate studies, training your manual skills. But considering the rapid advance of dental knowledge, it is a continual challenge for them to maintain their competence. And here we speak about continual education, yeah, lifelong education. So moreover, it is not just the scientific knowledge or technical skills that dentists have to develop and maintain, but also ethical knowledge, skills, and attitudes as well. Since new ethical issues, they might arise, yeah, because we live in multicultural, yeah, environment where, as I told you, that there are subdivisions, yeah. And these new ethical issues, because of that, they can arise with changes in dental practice and its social and political environment. And that's why we highlight, especially in our program, the importance of emotional intelligence, the importance of ethics, of leadership, and these are the core and important competences in your daily life practice. So next slide. So autonomy or self-determination. Autonomy or self-determination is the core value of dentistry that has evolved the most over the years. Individual dentists have traditionally enjoyed a high degree of clinical autonomy in deciding where and how to practice. Do you remember our first lecture about types of dental clinics, right? Dentists collectively, I mean the dental profession, they have been free to determine the standards of okay, 1 second. So if you remember, we discussed with you the types of dental clinics. Yes, solo practice. What else? Group practice, right? And if there might be also an option as a hospital employee or multi-group specialties. Yeah, and solo practice, multi-specialty group. Of course, at solo practice you have the highest level of autonomy, and then it gradually decreases. Understandable? Yeah, and usually dentists in solo practice, they enjoyed by the autonomy, yeah, of their everyday dental practice. So as do physicians, dentists consider that clinical and professional autonomy benefits not just for themselves, but patients as well, since it frees the dentists from government and corporate restraints on providing optimal treatment for patients. However, governments and other authorities are increasingly restricting the autonomy of dentists. Example is that government can regulate the number of dentists per area. For example, number of prosthodontics per this particular area, yeah, in the city, or number of maxillofacial surgeons. Nevertheless, dentists still value their autonomy and try to preserve it as much as possible. At the same time, there has been a widespread acceptance by dentists worldwide of patients' autonomy, which means that patients should be the ultimate decision makers in matters that affect themselves. There are examples of potential conflicts between the dentist's autonomy and respect for patients' autonomy. So what are the principles of dental profession? Yeah. So a dentist must practice according to the art and science of dentistry, yeah, follow the principles of humanity and safeguard the oral health of patients, irrespective of their individual status. And these international principles of ethics for the dental profession should be considered as guidelines for every dentist. These guidelines cannot cover all local, national, and traditions, legislations, or circumstances. These are the international guidelines that they can be applied in every country, and also local entities, they add extra recommendations. So now we will continue. Are you okay? Or maybe you need a break? It's okay. So now we will speak about public health. Unfortunately, my presentations I explained you due to lockdown and my technical issues cannot be open. I will upload it when my technical issue is going to resolve after lockdown. No worries, you will have time to read it because you have also, before the first midterm, you have almost 1 month. So, or 3 weeks, so it's more than enough time. So the term public health as used here, so it refers to both the health of the public and also to the dental specialty that deals with oral health from a population perspective rather than as an individual basis. I can say that there is a great need for specialists in this field, especially nowadays, right? In every country to advise on and advocate for public policies that promote good oral health, as well as to engage in activities to protect the public from preventable diseases and other oral hazards. I will give you an example of how you're going to be engaged. So our university is committed to increase the awareness of dental oral health, and you'll be engaged in different entities, for example, schools, and working with kids, explaining them about dental hygiene, explaining them how to proper brush teeth. I think it's going to be a very nice activity for you. What do you think? But of course later on, not now. And we have also another surprises for you. Okay, so the practice of public health, sometimes public health dentistry or community dentistry, relies heavily for its scientific basis of epidemiology, which is the study of the distribution and determinants of health and disease in population. All dentists need to be aware of social, environmental determinants that can influence the health status of their individual patients. Can you give me examples of how social or environmental determinants can influence on the oral health condition? Fluorosis. Do you know what is this about? Fluorosis. Okay, I will open for you. Picture. Give me a second. In order for your better understanding, okay? I will show you now the picture. Give me a second. So can you see now? Can you see the picture? Please tell me. Hmm?
Yeah.
Yes, so this is example of fluorosis. Do you know what is this is about? This disease is about chronic intoxication of fluoride. And this is how teeth look like in case of fluorosis. So you as a dentist the environmental changes that can influence on oral health. And this is one of the examples. So if you see patient with fluorosis, can you see? So most probably this patient has been raised or lived in a place where the level of fluoride was too high. So it was an intoxication. Yeah? So this is about epidemiology, one of the examples I gave you. So most probably you can share with me how social patterns, so behavioral patterns can change oral health or habits maybe. Okay, I will give you one more example about habits. So pacifier. If a child uses it for a long, long time, what do you think can happen? So a child used pacifier for 3 years or for 4 years. How it can influence to the position of the teeth? Okay, guys, do you understand what I'm talking about? Do you know what is it, pacifier? I would like to receive some feedback from you. I'll show you the picture. So they may not practice regular teeth brushing. Social pattern, behavioral pattern. Yeah? Okay, one of the example. Or they have poor beliefs in which they can lead to a decline of oral health. Yeah, and in this case, it's very funny when a child explains me, oh, I brush my teeth every day, but eventually I see huge dental plaques. Yeah, so, and in this case, I use a special coloring solution, and I show them after they rinse their mouth with this coloring drink, and approximately all the teeth, they become blue or red with enhancement colors of dental plaque. And of course, they're a little bit surprised in a way, yeah, and sometimes frightened. And of course, we explain them how necessary it is to brush the teeth. Yeah, this is one of the ways to visually explain your patient, your younger patients, the importance of toothbrushing, yeah, and to increase the motivation. So, is it cause of fizzy drinks? Could you please clarify? I was talking about pacifiers. I will show you an example how behavioral patterns and habits, they can change position of teeth. For example, when a person puts pencil permanently in the mouth, yeah, or a pen, eventually the frontal group of teeth, they could be protruded. Yeah. So it's a permanent mechanical, pressure to the frontal group of teeth. And the same with actually with pacifier. When a child stops using pacifier after 1 year old, there is a risk of developing of misalignment of teeth, and eventually wearing different appliances in order to align the teeth. And of course, it's a big problem for some parents to make a cessation of pacifier, because usually kids, they sleep better, and there are different methodologies, psychologically positive methodologies, to stop using pacifier. And one of these methodologies is that when a child is motivated to give pacifier to someone, and it is child's wish. And I'll give an example. I was in Copenhagen, and the orthodontist there told us that in a zoo there is a special area with cats, and all this area is filled with pacifiers. Why? Because by the recommendation of dentists, parents take their children to this area, and they explain them that these cats, they need a lot this pacifier, that these cats, they have a lot of kittens, and it's necessary to share pacifier with them. And usually kids, they are motivated to share their own pacifier with these kittens, and psychologically, this action to give goes in a more positive way. So this is one of the examples how to deal with the effect of giving something, yeah, to psychologically to protect child from a stress. I think it's lovely. Yeah. So all the area in zoo was filled, this area with pacifiers, and they were this area with kittens. It was surrounded by kids. So it's a nice decision, in my opinion. Okay, I have one more. Okay, yes, exactly. Overusing tobacco, cigarettes, alcohol can lead to this as well. So, periodontologist, yeah. If a patient has a habit of smoking, and if a patient visits periodontologist, number one recommendation is smoking cessation, yeah. one of the most important, because smoking has dramatically bad influence on the condition of soft tissues of the oral cavity. Okay, not only on condition of the soft tissues but oral cavity in general health, in condition of health in general, but it's one of the most important factors affecting health. So it's very, very crucial and important, yeah, smoking cessation, yeah. So next. So public health measures as community water fluorization, as I told you, in case of fluorosis. Tobacco-free workplaces are important factors in the oral health of individuals, but social factors such as housing, nutrition, employment are equally, or sometimes if not more, significant. Dentists are seldom able to treat the social causes of their individual patient's illness. Although dentists, they should be able to refer patients to available social services. And dentists, they can contribute, even if indirectly, to long-term solutions to these problems by participating in public health and health education activities, monitoring, reporting environmental hazards, identifying and publicizing, writing articles about health effects from social problems such as abuse or violence, and advocating for improvements in public health services. One of the examples how dentists can be effective in abuse determination is that when, for example, in pediatric dentistry, when a child comes with parents, and sometimes dentists can witness the abuse from parents to a child. Yeah, it's unfortunately we can see it. We can see it, and it's very, very sad, of course, to see this aggressive behavior of parents towards child. Sometimes, though, the interest of public health may conflict with those in individual patients. For example, when notification is required for certain contagious diseases, or for cases of child or elder abuse, as I told you. Now I would like to tell you about COVID-19 cases and dentistry. As you know, dental profession is considered as a high-risk profession. That's why approximately all the dental practices, they also have been locked down, and only patients could refer to dentists in case of emergent situation, for example, in case of severe trauma or pulpitis or extreme dental pain, right? Now gradually the dental practices, they start to reopen. However, it is necessary to maintain proper guidelines in order to protect dentists, the staff, and the patients, for sure. And this includes personal protective equipment. Yeah, there are specific guidelines about timing, about equipment, and about number of people that might be presented in the room simultaneously, and everything. These guidelines, they are published at the FDI and at World Health Organization websites. And for sure, dental professionals have to follow these recommendations and take into considerations all the risks associated with that. So dentists, they have been vested with the authority to certify that patients, they have appropriate dental condition that would qualify them for such benefits. And although some dentists, they are unwilling to deny requests from patients for certificates that do not apply to circumstances when we talk about conflict. Yeah, they should rather help patients find some other means to support that do not require unethical behavior. So the recognition that dentists have responsibilities to the society in which they can be expanded to include a responsibility for global health. This term refers to health problems issued and concerns that transfer to national boundaries that may be influenced by circumstances, and nowadays we can see this example, yeah, or experiences in other countries that are best addressed by cooperative actions and solutions in the international level. I would like to highlight, guys, that it's even, especially nowadays, science have no borders. Cooperation have no borders. It's crucial and important to, even especially now, to cooperate with each other. For example, in China, the physicians, doctors, and dentists, they have already experienced this condition, and of course, they share their knowledge with us, and we accept it. So this is moment of how science, interaction, and cooperation and understanding can get us to the better outcome globally. So we have finished our lecture for today. This is the last lecture on my behalf. I will upload the presentations, the remaining, by Monday, I hope so, once my program will be updated and installed. If you have any questions, please, you are more than welcome to ask me. Do you have any questions? No. Okay, then. I wish you all the best. Take care of yourselves, and good luck. Please clarify. I received a message, but I cannot understand to what you are referring to. Cookie.
I know you were just asking if we had any questions, and I said no.
Ah, okay, okay. I thought in other context. Okay. So thank you for your attention. All the best to you and your beloved ones. Take care of yourselves, and I hope that we will meet soon. Bye. Thank you too.